Hello, Walt. How you doing today?
I'm doing fine, Chuck. Ready to shoot the opening, but where's your bike kit?
This is my outfit for the opening. I've got an idea for a new opening for our show. We got to class this thing up a little bit. This is the latest in 1960s cool cat attire, shark skin.
But for a bicycle show, shark skin?
We're going to start with a theme song.
A theme song? That sounds good. What's the theme song?
Allow me to demonstrate, pal. Bring down the lights. Cue the orchestra.
We don't have an orchestra.
That summer wind came biking in from across the sea. It lingered there, warmth in the air.
Wait a minute, Chuck.
Won't you?
Those aren't the words to that song.
Those aren't the words to Summer Wind.
No.
Frank Sinatra wrote Summer Wind. Take it up with him, not me.
It wasn't Frank Sinatra. It was Johnny Mercer who wrote that song.
Well, then take it up with Johnny Mercer. He wrote the words.
Yeah, but not those words, Chuck.
You just told me Johnny Mercer wrote those.
That's not what I said, Chuck.
Okay, cut.
All right, let's try something different then. If Summer Wind won't work, I got an idea. Bear with me here a moment, Walt. Can you hold this for me? Thank you. Can adapt to any situation. I'm ready to go here.
And what is this new outfit that you've got now, Chuck?
Allow me to demonstrate. Biking in the USA.
I don't think so, Chuck. I really don't think so.
Okay, cut.
All right, Walt.
Okay, come on.
Go get changed.
Let's go figure out something else.
All right. Oh, wait, I got an idea.
What's the idea now?
Biking 925, crazy if you
I can't see you dressed as Dolly Parton.
Cut.
Hi, welcome to Bike On CCP TV, the Emmy-nominated educational channel of Community College of Philadelphia. Bike On is CCP TV's program about bicycling and bicycle-related issues in and around Philadelphia. I'm Chuck Herbert, and this is my co-host, Walt Johnson. Walt is a professor emeritus at the college, having taught data processing and computer information systems. He's also a retired systems engineer from IBM. He's a native Philadelphian who worked with IBM customers all over the United States and around the world, in places like China. Like many of us, Walt rode bikes as a child, then returned to cycling later in life. In 1976, he rode across the United States, from Oregon to Virginia, as part of Bike Centennial, which grew to become the Adventure Cycling Association that we have today. He's been seen around Philadelphia over the years on his classic Peugeot bicycle, his Bill Boston custom bike, his Brompton folding bike, his Cannondale tandem, and his current favorite, his Cannondale road bike.
Chuck has been teaching computer science at the Community College of Philadelphia for more than 30 years. He's been a curriculum coordinator, department chair, and assistant dean. He is a board member of the Bicycle Club of Philadelphia and currently serves as the club's vice president. He's also the chair for this year's Scenic Schuylkill Century, the club's annual one-day, 100-mile ride held every September.
On today's show, we're going to talk with Kira Sender, a practicing physical therapist with a doctorate in physical therapy. She'll tell us some of the things that she sees as a physical therapist that can help bicyclists stay healthier.
Kira is also a bicyclist, so part of our conversation is about better practices while cycling. We'll talk about riding posture, pedal float, and a few other things that can affect a cyclist's health and help us to avoid injuries.
Kira, thanks for being here today. We'd like to talk to you for a while about the work you do as a physical therapist, and in particular about bicycling and some of the things you see as a physical therapist that could help bicyclists be more informed and maybe fewer injuries, be a little bit healthier when they're out on their bikes.
Absolutely, yeah.
I understand you're a bicyclist.
Yeah, I'm new to biking, but I have been trying to increase my mileage a little bit, trying to start commuting to work a little bit, that kind of thing. So,
And when you ride, I imagine you have perfect posture and so on.
oh, of course, yeah, absolutely.
So I guess there's a couple different things we want to talk about today. One of the things that we wanted to ask about is the kinds of injuries that bicyclists have that you see as a physical therapist. They have an injury, they want to recover from the injury, and that's when they get to deal with you.
Right, yeah, absolutely.
So what are some of the common kinds of injuries that you see that are bicycling related?
Sure. So I think, first of all, a lot of the overuse type injuries that we see that patients come into me for occur in the lower extremities. Traumatic injuries coming from bike crashes, bikers getting doored from drivers that are sitting in the bike lanes, my own personal gripe.
We're going to be scaring people away from bikes.
Those kinds of stuff happen in the upper extremities. So that kind of stuff will, a person will go to the hospital for, and then they'll come into me either after surgery or something like that.
Right.
But the large majority of injuries that we see, over 62%, occur in the lower extremities, and those are the most common. So what's interesting about that sort of statistic is that a lot of these injuries are preventable.
Right.
And a lot of what I see can be prevented with things as simple as just proper bike fitting and having a good balance in terms of flexibility and strength.
So there's things that bicyclists can do in terms of the way they ride their bike, as well as in little things like stretching and so on, strength exercises before and after they ride their bike.
Absolutely.
And that's the stuff we're going to see today, I hope.
Yeah, for sure.
You mentioned two different kinds of injuries, overuse injuries and traumatic injuries. I guess the traumatic injuries come from banging into something, like when you fall off the bike.
Yeah, so mostly from accidents or falls. Whereas the overuse injuries really come from just logging lots of hours with being in a static position, repetitive loads on your joints without frequent enough rest breaks, or just the muscles not having the flexibility, range of motion, or endurance to tolerate those repetitive loads.
So besides, when you say overuse, and it comes from the repetitive stress of doing it again and again for long periods of time, but imagine also how you do it is just as important. You might get an overuse injury from a shorter period of time if you're in the wrong position, for example.
Right, it could come on much quicker. Yeah, absolutely. Yeah.
How many of those things are strains like the tendons, like the Achilles tendons or tendons in your knees or things like that?
Yeah, so most of the injuries that I typically see in cyclists occur in the knees, the low back, the neck, and then we sometimes see some like hand pain or numbness or foot pain and numbness, but those are largely the types of injuries that I see from overuse type injuries on cyclists.
Do you know if the knee injuries, which I've been hearing, and I've been riding for 45 years, but I see a lot of knee injuries that I think at least, are due to trying to use big gears. Do you know whether that's true or?
Absolutely. So pushing big gears, climbing up hills, spending a lot of time kind of out of the saddle and standing, it can put a lot more strain on your tendons, on your joints, in your knees. So, a lot of what I've seen is being able to increase your cadence when riding. So, switching down to an easier gear and increasing the cadence so that you're not spending so much time grinding on your joints with each pedal stroke helps to decrease some of the joint forces on the knee and some of the strain on the tendons as well. But a lot of it also just comes from having insufficient strength to be able to tolerate those gears and those hills.
One of the things that I used to hear was that your pedal speed, your cadence should be about 85. Now I'm hearing that it's higher than that. What is your opinion on it, or do you have an opinion on this?
Yeah, mostly what I see is 80 to 90 as a recommendation. That seems to be sort of the magic number for both cycling and even for runners too, looking at 180 strides per minute. So I think that there's something to be said for just efficiency, maximizing efficiency with your pedal strokes, as well as minimizing sort of joint contact. But what is definitely the pattern is sort of the faster, within reason and within control, the faster that you're pedaling, sort of the less strain you're putting on
your knees.
on those joints. Yeah.
It's the pace happens to be very similar to what you see in the military also when they march. It's 90 steps a minute. So I would imagine that's somehow related to what's happening with the muscles too, the flexing and relaxing of the muscles.
Yeah, so I think it's definitely related to sort of the efficiency of your muscle contractions. Something kind of cool happens when you start training in a particular way, in a sports-specific way, and that's your brain starts to develop better efficiency at recruiting muscle fibers for that particular task, whether it's running, whether it's walking, whether it's cycling. That's true. So part of it is that you are getting stronger by kind of cycling more, spending more time on the bike, increasing your cadence, that kind of thing. But what I think really is happening, and what kind of separates the elite cyclists from sort of the more novice cyclists, is that their neuromuscular control, or their ability to recruit those muscle fibers, is significantly higher. And there's also other adaptations that happen sort of at a cellular level too. But as far as being able to more quickly and efficiently recruit your muscles in a particular pattern is really kind of what separates the elite from.
So if we train enough, we can all be Usain Bolt when we run the 100.
Right, exactly, yep.
We run 100 meters. You mentioned the fact that when you're going uphill, you lower the gear so that you're not pushing as hard, and that's better for your knees. What other kinds of things affect the knees? Because as Walt said, we tend to see a lot of people with knee pain and knee injuries cycling.
Yeah, so I think the primary thing where you have to start is with the bike fit. And so I mean, if you're spending hours on a bike, and even if you're not, it's important to have a bike fit, but especially the longer time that you're spending on a bike, you're staying in a static position. I know that you had a bike fitter come in, so I think that's really good knowledge. I'm not a certified bike fitter, that's like full disclosure, but I know enough about sort of posture and the way that your joints can be loaded with sustained prolonged postures, and having your saddle height too low can or too far, having the saddle too far forward can kind of really overly flex your knees.
Right.
So there's when you go to a bike fitter, there's certain measurements that they take that kind of throughout the pedal stroke, where they're trying to identify what angles your joints are in, your knee, your ankle, sort of where your knee lands relative to where your foot is.
Right.
That kind of thing. And so I think the first place that most bike fitters start is at the saddle, because that's where your support is.
So let's talk about that for a minute. The saddle, the bike seat. What happens if the bike seat is too low? Which is something I see very often with novice cyclists. If you're riding along the Schuylkill River Trail, it's not unusual to see people, for example, with rental bikes. And the seat is very low.
Right.
So explain what happens when the seat is too low.
Yeah, so a lot of things can happen when the seat is too low. So first of all, your hip flexion angle is going to be way higher because your seat is lower, you're sitting lower, your knees are coming up higher relative to your hips. So you're going to be kind of jamming up your hip joint a little bit.
So the first thing is when the seat is low and your knee comes up, you're bending your hip more than you would normally bend
right,
it.
Exactly. It's like the same thing as if you were sitting in like a really deep sofa or a really deep couch, right? May not be, it's going to force your back into a little bit more of a flexed position. It's going to put more bend in your knee, and it's also going to put more bend in your ankle as well. So it's just kind of, if you're starting in that posture, you're setting yourself up for failure or potential overuse injury just from inherently being in that position.
And what does it do to your knee when the seat is too low? When you're pushing down with your knee and your hips are lower than your knees, what happens then?
Right, so first of all, you're at a poor mechanical advantage, so you're not going to be able to get as much power through your quadricep muscles to propel you forward. And that's just from an efficiency standpoint. You're going to fatigue quicker. But Also, you're going to be overusing, you're going to be putting more compressive loads through your knee joint. You're going to be kind of requiring more of a pull at sort of an awkward angle at your patellar tendon. So there's a lot of things that can kind of go wrong at the knee joint itself when you're in a more flexed position.
Now tell us about the patellar tendon. Where is the patellar tendon?
So yeah, so you have your quadricep muscle, which is like right on the front of your thigh.
Right.
And then the patellar tendon you have your quadricep tendon, which connects to the top of your kneecap, and then you have the patellar tendon, which attaches from the patella to your tibia or your shin bone.
So where would you feel the pain if you had that problem?
So if you're looking at like a patellar tendonitis, it's kind of right below that kneecap.
Just below the kneecap?
Yeah, so depending on what structures are being loaded, you're going to feel pain in different areas of, if we're talking about the knee specifically, then the knee. And you can go to the doctor, and I see cyclists with all kinds of diagnoses, all kinds of names for their pain.
Right.
So whether it's arthritis or patellar tendonitis or meniscal tear, which is really typically more common in runners, but there's patellofemoral pain syndrome. There's tons of different sort of names for knee pain in the front of your knee, and depending on what structure is involved, I may treat you differently. But having the proper bike fit to start out with, or if you're having knee pain and just fixing your bike fit is sort of the first step in terms of like getting back into cycling and avoiding recurrence of this problem.
In line with that, I have seen several bicycle riders either riding with some kind of basically a big rubber band around their leg, or every once in a while things that are like taped to their knee and sometimes to the back of the knee. How does that affect those tendons?
Yeah, so for the big rubber band that you're talking about, that's called a patellar tendon offloading strap. So what it does is it sort of changes where the pull basically it changes the attachment site of the patellar tendon from where it's pulling at the attachment site on the bone to kind of where the strap is kind of intercepting it. It kind of takes some of the pressure and some of the pull off of that sort of that insertion site where the tendon is constantly pulling on the bone. So that can help. That's not a bad strategy for offloading the sort of the cause of the pain. But like I said, if you're continuing to ride that way and not changing anything else, it's really you're just kind of taming the fire rather than putting it out.
So the first and most important thing in terms of taking care of your knees is to make sure that the saddle is high enough on your bike.
I think that's definitely a good first place to start. Yeah.
That's what we're hearing several times.
And not ride a lot of big gears uphill.
Right.
That's right.
Yeah, and then like I said, the other thing is just sort of good balance between strength and flexibility. So having sufficient quadricep strength, gluteal strength, calf strength, the muscles that are propelling you forward, good core stability to make sure that you're not getting a whole lot of lateral movement from side to side that can be awkwardly sort of causing different rotational forces or loads on your joints, and then sufficient range of motion and flexibility in your knee to be able.
Now,
to
what
do
about how far forward or backward the seat is?
Yeah, so the further that you are forward, sitting forward, it's gonna kind of push you into a little bit more hip flexion, a little bit more knee flexion, a little bit more ankle flexion. So sometimes moving your seat forward is appropriate for other things, for your neck, for your back, for lots of other reasons. But other things may need to be adjusted accordingly to make sure that you're not, again, just jamming up some of the other joints.
So a good bike fitter, or even someone at a bicycle shop who knows a lot about it, may not be a professional bike fitter, can give somebody advice on how all these things are related, the handlebars, the seat, etc. It's not just that if you move the seat forward, it puts more strain on your knees, if I'm hearing you right, but that could be causing other problems as well.
Right. So if someone's coming into me as a patient who is a cyclist, I'm not having them bring in their bike. I'm not doing a bike fit and all that kind of stuff. I'm assessing I'm looking at them as a person. I'm looking at their whole system. And then I talk to them about the way that their bike is set up. I have had people kind of take pictures of themselves on the bike, that kind of thing. But my first sort of go-to is, go get your bike fitted. That's if you're returning to sport and we're at that point, you're getting your bike fitted before you're hopping back onto that thing. So yeah.
So bike fitting costs a few dollars, but it's well spent. It's preventative.
Yeah.
It's like preventative medicine.
Absolutely. If you don't have pain yet, that's still a reason to go get a bike fitting. That's even more of a reason to go get a bike fitting, because you want to make sure that you're putting yourself in a good position. It's kind of hard to fight back from an injury.
Right.
You might as well start out on the right foot. So
Now, the seat has to be in the right position, forward and back, balanced because of all these different factors. What about the handlebars?
So handlebar height is important, as well as sort of handlebar width, where you're holding your hands, that kind of stuff. Based on what kind of bike you're riding, if you're riding on a road bike, you have to kind of decide whether you're going to be spending most of the time on the hoods or on the drops,
Right.
and that's going to affect sort of how much pressure you're putting on your hands, on your arms, kind of how much forward tilt you have in your trunk. And how much sort of compensatory neck extension, or how much you're going to be looking up
Right.
when you're going to be in that position. So it puts a lot of, so basically what you're going to be asking of your body in terms of position is going to be sort of determining what you need from as far as range of motion and strength in your upper extremities too. If you're going to be completely sitting upright in a bike, you're not going to be putting a whole lot of weight on your arms and that kind of thing. You're going to have a different bike setup than somebody who's racing or spending a lot of time more kind of
On
lower
the road
down
a
on.
lot.
Yeah.
Now, on road bikes, where you have drop bars, there's at least 3 different basic positions. You can be on the hoods, you can be on the top of the bars, or on the drops. But on mountain bikes, when they have straight bars, you don't have that range of change. Do you
That's
see
true.
more accidents or more problems with mountain bikers than you do with road bikers?
So honestly, I don't see that many. I see more road cyclists and like racers and commuters and that kind of stuff than I do see mountain bikers. However, what I see mostly in mountain bikers is it's rougher terrain, right? So core stability is even more important than ever. Having that balance and being able to react quickly to obstacles. But a lot of mountain bikers tend to kind of death grip their bars a little bit more, because it's much more sort of bumpy terrain and that kind of thing. So that's where I see some more elbow tendonitis issues just from over gripping, some maybe numbness or neuropathy in their hands just from like overloading or putting too much weight on their handlebars. So there are modifications that you can make in terms of height of the handlebars.
Now, for commuters very often will have straight bars too. Do you see problems with them or not?
Yeah, of course. So bike fitting is appropriate across the board, regardless of sort of what bike you have. So based on the height of the handlebars, sort of the higher up that you are, the less forward lean you're going to have. You're going to be a little bit more upright posture, and you're not going to be weight bearing as much through your arms. So that's going to inherently put less strain on your grip. It's going to put less strain on sort of the nerves as you're kind of compressing your hands. You're going to be in a little bit more relaxed position for your shoulders and your neck, that kind of thing.
And your back as well.
And your back as well, right? Yeah, absolutely. So if you're sitting on the hood, if you're sitting on the bike and your hands are on the hoods, you're looking at like a 30 to 40 degree trunk lean with your back kind of nice and straight, nice flat back, and not kind of putting too much weight on your arms. More just for balance than anything else. So that's sort of ideal. When you're on the drops, you're definitely at a bit of a steeper sort of grade of a trunk lean. You're at about a 60 degree lean there, and you're putting a little bit more weight through those upper extremities, through those hands. If you're fitted appropriately, and there's sort of a little bit of wiggle room based on your level of comfort, your core stability, how much you need to rely on your arm support. The higher up your handlebars are, sort of the less weight you're going to put on them. The lower down they are, the more aerodynamic you are. If you're looking at like tri-bikes
Sure.
and stuff like that, they're almost horizontal,
right?
But they are going to be putting a little bit more weight through their arms. Things that you can look into for tri-bikes, and racing bikes are things like Aero Bars, you know, that kind of thing, which will offload your hands and your grips, and you'd be able to
elbows or for your forearms,
and kind of distribute your weight more evenly through your forearms.
So the Aero Bars that you're talking about are the extensions we see off the front of the handlebars on triathlon bikes primarily,
right.
and people are leaning on those to take some of the pressure off their hands.
Right, exactly. Yep.
What about the position of the wrist and the angle of the wrist? I know that when we deal with computing, we see a lot of people typing and they develop carpal tunnel syndrome over years. Are there things similar to that that can happen if your wrists are bent the wrong way when you're grabbing the handlebars? Yeah,
so the more kind of extended your wrists are, you need a certain amount of extension to be able to effectively grip. That just puts your sort of flexor tendons and flexor muscles in your hands in a better sort of mechanical advantage to be able to grip strongly and efficiently. So there's a certain amount of extension that you want your wrists, but if you're overextending your wrists, it's going to really overload your joints, and it puts a little bit more pressure on the carpal tunnel, which can lead to some like burning pain, numbness, some weakness in your hand even, that kind of stuff.
So they tell us that when we type, our wrist should be straight, but when you grip something, you're saying that it's natural to have a bent wrist when you're gripping something.
Yeah, So your grip strength is going to be significantly decreased if you're trying to grip like this versus with a slight...
As long as you're not bent too much.
Right, and it's the compressive load with biking, I think, more so than anything else, that we really see wrist problems with, and hand problems
and
with.
The compressive load is from pressing your weight against your wrist.
Right, holding yourself up through your hands.
And that's related to core strength.
Core stability. Core stability, balance, having proper sort of back strength, core stability, and again, the bike fit.
Well, I've noticed, I used to ride a hybrid bike that had flat handlebars most of the time. And in the last several months, I've been riding a road bike a lot more and riding with the drop downs and so on. And I've noticed, first of all, my trunk is getting stronger. And so I'm not putting as much weight in my hands now as I was a few months ago.
Yeah.
But in addition, you can grip the flat part of the drop downs, or you can put your hands up on the curves on the drop downs.
Right.
And it seems to have a different effect on the hands when you do that.
What I advise people is just to change it up more frequently, okay? It's the prolonged positioning in a loaded position that leads to problems. So the more frequently you can change your posture, I mean, within reason. If you're constantly adjusting, that's not efficient for anything. But if you're spending maybe 15 minutes in each sort of position and then just changing it up periodically, that's going to be sort of a better way to more evenly distribute. Give some of your joints, the way that you're loading your joints, a little bit of a break, that kind of thing. And I think that's true for building the core stability as well. That you mentioned with spending more time on the drops. Interval training, that's sort of I think the key for building up stability, building up your pace, building up your endurance, all of that. So kind of spending time in different positions and slowly building up into more time in the drops is a good way to kind of build that stability.
Have you seen any difference in how people relate to using backpacks or hydration packs on their back? Has that had an effect on their back pain or any other problems?
Yeah, I haven't had any patients who have complained of that being really the cause of it. Usually the hydration packs aren't too heavy, right? If that's all you're carrying, I wouldn't recommend carrying heavy backpacks or anything like that for distance reasons. But it certainly will put a little bit more pressure on your shoulders. It'll put a little bit more kind of a forward push on your back. So it's not too much weight where I think it would really make a huge difference. But if it's something that you're trying that's new, you may just kind of want to just be really conscious of your posture when you do it, and maybe take it out for a shorter ride to start. Yeah.
So when you wear a backpack, does it tend to make your shoulders curve down a little more? Your back is not as straight as it should be.
Right, exactly.
And you've said a couple times that keeping a straight back when you're bent over is important.
And if inherently when you're wearing a backpack, whether it's walking, hiking, riding a bike, that kind of thing, if it doesn't have sort of offloading straps in the torso or kind of across the chest too, it puts that pressure on your shoulders, and without even thinking about it, we kind of tend to just shrug our shoulders up, hold ourselves up a little bit more like this, and that leads to some trigger points and other sort of postural problems too. So I see that a lot. I see a lot of kind of posturing kind of more like this, whether it's from maybe wearing a backpack or just putting a lot of
Where their
weight
back
through-
is bent over a little more.
flexed forward, sort of that forward shoulder posturing, but also sort of shoulders up towards the ears rather than just being in a more relaxed sort of
And
natural
besides
posture.
contributing to back pain and back injuries,
Yeah.
it makes people look older than they are.
Absolutely. Right, yep.
You mentioned a
does
couple...
that-
As I straighten
Go
up.
ahead.
Yeah.
Does that affect your lower back at all?
Yeah. So, so being in a bike, being in a saddle for a while, it's really hard to kind of maintain great neutral spine posture, especially if you're new at it, and especially if you don't have a good bike fitting. But so you're inherently kind of being in a little bit more of a forward lean position, and if you don't have proper, low back strength, then you're gonna kind of tend to relax at your low back and slouch a little bit more. That puts more pressure on sort of the posterior or the back structures of your spine. It can lead to some disc injuries or disc protrusions and things like that. Lots of different kinds of muscle strains. So it's again, posture is really key here, and having sufficient strength to maintain that posture is really key. But like I said, the first strategy should be being able to maintain good posture on a bike with minimal effort, and the way that you do that is by making sure that your bike fitting is appropriate for you, that you
Now,
can tolerate that
besides the
position.
bike fitting, you talked about having the strength and flexibility in your muscles.
Yeah, mhm.
So there are some stretching exercises, some strength exercises that people can do to help them become a better bicyclist.
Yeah,
So
for sure.
can you show us some of those exercises?
Yeah, absolutely. Yeah.
Okay, well, we're going to take a few minutes to look at some of those exercises, and then we'll come back and talk a little bit about what we saw and continue our conversation. Well, one of us had to step forward to be the guinea pig for the stretches and exercises that Kira wanted to show us. And since CCP is a union shop, Walt goes first with his seniority.
It's a tough job, but somebody's got to do it.
All right, so we're going to start out by going through a couple of different lower extremity stretches, and we're going to kind of work through the whole chain. These are all muscles that are fairly active during cycling. So, Walt, the first stretch that I'm going to show you is the hamstring stretch.
Okay.
Okay. We're going to start with the one leg bent. So you're going to bend this knee with your foot flat on the floor. Okay. And we're just going to use a belt. You can use anything. In the clinic, we use like a hamstring strap or a stretching strap, but you can use a dog leash, you can use a belt, whatever you need. So we're just going to kind of loop the one end of the belt around Walt's foot, just like that. And Walt, you're going to hold the end of the belt. You're going to use both hands to kind of just pull that leg straight up. So bring it back down just a little bit. You want the knee to be pretty straight when you do this stretch. So you're just gonna slowly take it up, keeping the knee stretched. Good, and let that head rest down nice and careful there. Good. So he starts to get a little bit of knee bend there. Mm-hmm. It's okay if the knee bends. You're gonna get a little bit more of a stretch lower down into the muscle belly rather than closer to where the tendons are attaching behind the knee. But you're gonna hold this stretch at a sort of a comfortable level for about 30 seconds, and you're gonna do it 3 times on each leg. Okay, so once you've held it there for 30 seconds, you'll just bring it down nice and slow.
Up on the top end, it hurts a little.
Where the knee is?
Yeah,
Yeah.
Right behind the knee.
Yeah, so you don't have to bring it up quite so high, or you can also bend the knee a little bit to take some of the pressure off of those tendons as they're attaching into the knee, and you'll feel it a little bit lower down towards the muscle, like behind the thigh. Give that a try and see how it feels. Right, so just bring it to there, and bend the knee just a little bit.
That feels a little better.
Feels a little better. You feel a little bit lower down? Yeah. Okay. I like to do the hamstring stretch laying down because it keeps your back fully supported and it allows sort of less strain on your back than doing something standing where you're just bending forward or doing something sitting where you're doing like a forward reach type stretch.
That's one I've never done.
Okay. So that's a good hamstring stretch. All of these stretches are going to be 30 seconds for 3 repetitions on each leg. All right, well, so the next stretch that we're going to do is a prone quad stretch. This is going to stretch out your quadricep muscles. So I'm going to have you flip over onto your stomach. Take the pillow out of the way. Okay, so for this stretch, you're gonna bend your knee here, and we're just gonna loop that same strap kind of right over your foot. You're gonna reach, you can actually bring your hand back up over. We're gonna let this leg bend, and you're gonna reach behind your shoulder with your arms. The strap is a little short.
Yep.
Yep, okay?
Mm-hmm.
And you can use both hands if you want to. You can use this hand just to pull it kind of in a straight line, right? So just using maybe the right hand.
I can feel that pulling on the front of my
In the front of the thigh.
hamstring. Yeah.
Right, okay. You can also use, if a belt
Sure.
if a belt is too short, you can also use like a long towel or a bed sheet or something like that. That's going to be, you can just kind of loop right around the foot and pull that side. So this stretch is this stretches both the quadricep muscle as well as the iliopsoas muscle and the hip flexor by kind of staying in a full neutral kind of hip position.
Okay.
Again, this stretch is going to be held for 30 seconds for 3 repetitions, and then we would switch over to the other side.
Okay.
All right, so the next stretch that we're going to do is for the hip flexors.
Okay.
Okay. So in order to do a good hip flexor stretch, you can do it in a bunch of different ways, but we're going to do it kneeling. So I'm going to have you come up into a full kneeling position, Walt. Why don't we turn around to face this way? Okay, so this sort of kneeling hip flexor stretch, you're going to go into a high kneel position. Okay? And I want you to bring that right foot a little bit more forward. You're going to stand up nice and tall. Okay? I want you to get your pelvis, point your pelvis kind of forward and straight ahead. And you're just going to do a forward lean into this stretch. So keep your trunk upright, your head up, your shoulders up. And you're just kind of going to feel a stretch in the front of your hip there.
Here?
Yeah. You feel it?
Yes.
Good. So you're going to hold this position again for 30 seconds and do 3 repetitions. If you're not getting a good stretch into the front of the hip here, one way that you can get a little bit more of a stretch is to bring your arm up overhead to the opposite direction. So you would be leaning towards the left, up overhead, just like that.
I'm losing my balance.
And
Now I feel it.
there you go. And you would just lean slightly that way. You get a little bit more of a stretch kind of in the front of your hip there.
Good.
Okay? 30 seconds, 3 times each leg.
Okay.
All right. Think that, and then one more stretch for your glutes we would do laying down as well, okay?
Okay.
So I'll get you laying back down on your back. Should we maybe flip around the other way?
Okay.
Okay. Okay. So you're going to lay back down. Here's your pillow. There we go.
Thank
Okay, you're welcome. So you're going to bend both of your knees to start out here with your feet flat against the floor, okay? So this stretch is for one of your gluteal muscles. It's called your piriformis muscle. There's a couple of different ways that you can stretch this muscle. So the way that we're going to do it here, Walt, is you're going to cross this leg over this leg. Good. Okay? And we're just going to kind of shift it a little bit, open up your leg a little bit here. Good. You're going to use your hands to grab between your legs. So one hand is going to go between this way. Yep, good. And then the other hand is just going to go over the top of the knee. And you're just going to pull that leg towards your opposite shoulder. Good. Do you feel stretch kind of in the front of your, or in the back of your glute there? Yeah.
Yes.
Okay. So again, this puts very little strain on your low back. You just want to be careful that you're not rotating your shoulders or rotating at your low back when you do this stretch. And you should just feel like a good deep stretch right in your glute muscle. So this stretch will also be held for 30 seconds and performed 3 times on each leg. We're going to take a look at some really good core exercises that are going to strengthen your lower back muscles, your abdominal muscles, your oblique muscles, all the muscles that we kind of talked about earlier that are really involved in good stability on the bike. All right, well, so in this position, the first exercise that we're going to do is a bridge, okay? What you're going to do is you're going to have your feet about hip width apart, okay? Good, and nice and level. That looks good. You're going to keep your knees apart so that they're over your toes. We don't want your knees to be falling inwards. You're going to keep them apart, okay?
Okay.
And what you're going to do here is you're going to tighten up your glute muscles and give them a good squeeze, good butt clench, and then you're going to lift your hips off of the table or off of the floor. Good. Okay, and you can leave your arms down at your side. Good. What we're looking for here is that the pelvis is level, that we're not getting a whole lot of rocking in the pelvis, as well as that we're keeping the glutes off of the floor equally. One glute isn't falling lower than the other side. So you're going to hold this position for 10 seconds. You've already done more than that, and then come back down. Okay? 10 repetitions for 10-second holds is a good starting point. Doing 2 sets of 10 for 10-second holds is even better. If you can do that pretty easily without a whole lot of rocking, being nice and stable, not arching at your low back, we can kind of progress it and make it a little bit more challenging. I'll show you the progression here. You up for it, Walt?
Okay.
Okay, so what we're going to do is we're going to do that same position. You're going to squeeze your glutes, lift your hips off of the floor, and then what you're going to try to do is maintain this position. Keep your butt up and your hips level, and you're going to try to lift one leg straight up. You don't have to kick it up this way, just kick it out and make sure that that hip doesn't drop. So a lot of times what we'll see
Yeah, I'm
is
feeling
that
the stretch in the back of the other leg.
Okay, bring that leg back down to the starting position and then lower. So this one's tough. You need to build up the strength in order to do this. A lot of people, if they have insufficient gluteal strength, will feel this more in their hamstrings. You can get hamstring cramps and stuff like that. So you need to work into it. But that would be a good progression for this exercise. Okay, so that's the bridge.
Okay.
And that exercise works your glutes, your hamstrings, as well as your low back muscles as well. Okay, so next we're going to flip over onto your stomach and we're going to try to do a
Forward.
plank.
Head down there.
Yeah. So for a plank position, we're going to start with Walt on his toes and on his forearms. Okay? So go ahead and come back up. We're looking for a good neutral spine position here, okay? A lot of people will sometimes kind of hike their hips all the way up like this, or they'll sink really low and they'll arch at their back. Okay, we're trying to look for kind of a neutral spine position here, and Walt is doing an awesome job. Walt, how old are you?
80.
80 years old, no big deal. So he's doing great here, and you can definitely progress this exercise with some leg movements, kind of alternating, lifting one leg up at a time, that kind of thing. Walt's gonna try it and show off here. That's great. If you're gonna do that though, you wanna make sure that you have really good stability, you're not getting rotations in your pelvis, and you're not falling into a sag in your back or a big arch in your back. Okay, a good sort of goal would be, if you're new at this, starting for 30 seconds for maybe 3 repetitions, working up to 3 repetitions for a minute. Okay, and let's move into a side plank next, okay?
Okay.
Let me know if you need a break. You're like cruising through all of this.
Starting to breathe a little hard.
Okay, so for a side plank, what we're gonna do here is we're gonna, again, go on the forearms and on the toes, okay? Or on the sides of your feet. So feet are gonna be stacked on top of each other. Good. He's got his elbow right underneath his shoulder. Good. And you can bring that arm and just let it rest right on the side. Is that a little challenging?
Give me
Okay. Yeah, we can pad
my elbow.
the forearm a little bit.
Mm-hmm.
Okay. So once he's here, we want to make sure that the pelvis is not rotating forward. So we want to kind of roll that back a little bit. This is tough on the balance. Yeah.
It is.
Okay. So I can show you a way to modify this, and I can also demonstrate the full side plank as well. So one way that you could modify this particular exercise is by going onto your knees instead of onto your feet. So instead of going up into a full plank position like this, you can just do something like this. So just onto the knees.
Actually, it's easier for me going the whole thing.
Okay, if you bend your feet a little bit more, so try bending your knees so that your knees are bending backwards a little bit more, just like that. Good. Now just try to lift your hip up, just on your knees. There you go.
Okay.
Just bring that, and then you just want to make sure that you keep that back nice and straight. Bring your pelvis forward a little bit, hip up. There we go. And you want to maintain that position, okay?
Okay.
So ideally, you would try to maintain that position for about 30 seconds, 3 repetitions, starting out on your knees if it's too challenging on your feet, moving towards the full side plank on your forearm and on your feet. Okay. and you would do it on both sides. All right, the next exercise that we're gonna look into is called a quadruped exercise, okay? So what we're gonna do here is we're gonna go onto all fours. I'm gonna take this out of the way. All right, so for this particular exercise, we're gonna go on your hands. You want your hands to be just underneath your shoulders and about shoulder width apart. Good. The knees are gonna be just in line with the hips, and you want your back to be nice and straight. So you were good right there, perfect. The back is level, it's not sunken in or curved, and it's not arched up, okay? From this position, you're gonna try to lift your right arm just straight up. Good. And you wanna do that without kind of getting a lot of thoracic rotation or kind of shifting your shoulder up too high, all right? And then you can bring that back down. That already starts to remove one point of contact. Basically, by removing points of contact or balance points, you're going to start engaging your core muscles and those rotational stabilizers. So we removed one point of contact. That was a little bit easy. We're going to try removing two. So Walt, you're going to do that same exercise again where you're lifting your arm straight up, okay? And then from here, you're going to lift this leg as well, okay? So now he's working on rotational stability, making sure that pelvis isn't rocking back and forth, and that he can kind of maintain good alignment in his trunk, keeping that back nice and neutral, and not shifting his weight too far to the side when he kind of is supporting himself more on that right stance leg. Okay? Do you feel that working in your core?
Mm-hmm.
Yeah. So this is working a lot of different things. One thing that it's working that we didn't really talk about is it's working your neck extensors. Okay, and these muscles are definitely active when you are riding. And keeping a good neutral neck position is really important with this exercise as well. You don't want to be looking upwards, and you don't want to be tucking the chin down towards your chest. You kind of want to be looking straight in between your hands. Okay?
Mm-hmm.
All right. So those are some just kind of basic core exercises that are really useful for building lower back strength, abdominal strength, as well as some oblique and rotational stabilizing strength as well. All right, so I'm going to teach you guys one more stretch. This one is to target your iliotibial band. This muscle or this tendon kind of is a very thick, fibrous tendon that runs from your pelvis all the way down just below your knee. All right, so the way to stretch this guy, if we're doing the right leg, you're gonna cross the left leg in front of the right leg. You're gonna stick that hip out to the side. You're gonna bring your arms up and over and lean away from the side of the stretch, okay? And you should feel it kind of into your waist a little bit, that's fine, but definitely kind of into your hip and down into your lateral thigh. So Walt, I'm going to teach you how to do this one next, okay?
All
Wanna
right.
give it a try? So we're going to start by crossing the left leg in front of the right leg. Okay, good? We're going to stick that right hip out to the side, bring your arms up and over, and lean away from the stretch. Good. So Walt here is really kind of elongating this side, sticking that hip out, and stretching the lateral structures of his thigh. You feel that stretch?
Mm-hmm. I'm also losing my balance a little bit.
Yeah, so that's a good point. So if you don't have a physical therapist with you kind of stabilizing you, doing it up against the wall, just kind of holding on to something, you can kind of lean over and reach towards the wall to kind of balance yourself. That's another way to kind of do it too.
Okay.
All right?
Yes.
Same thing, 30-second holds, 3 repetitions on each leg. And that's really a good foundational exercise program for preventing injury.
Thanks, Kira. I've got a lot to work on.
Now that we've seen some exercises and some stretching that are good for bicyclists, let's talk for a minute about weight training. Kira, and the people that you see who have problems because of injuries they incurred from biking, are there things that could have been improved if they had done some weight training?
Sure. So I'm going to modify weight training with just strength training, right? Because you can build strength in lots of different ways, and you don't have to be, pumping heavy weights at the gym or anything like that. You can build strength in a lot of different ways. The muscles that are primarily most active in cyclists are your quadricep muscles, your gluteal muscles, your hamstring muscles, and your calf muscles. Okay, those are the primary kind of muscles that will propel you forwards, and you need sufficient strength for those big bursts of energy going up hills and things like that. That's where real strength training and building good, strong muscles is most important. So, doing things like squatting with proper squatting technique, you can add resistance to that with weights and that kind of thing. And there's also, there's a ton of different lower extremity sort of exercises that you can do, but it's definitely beneficial to build strength in those muscles at the gym. And that there's also upper extremity strengthening exercises that would be beneficial for cyclists as well. We talked a little bit about sort of the demands that are placed on the upper extremities when you're kind of spending a little bit more time lower down kind of on,
on a road bike.
On a road bike and even on a tri-bike. So, building strength in your triceps and your biceps, as well as some of your grip strength would be beneficial for individuals as well. That doesn't mean that you're, powerlifting with your wrists and doing, wrist extensions, but there are definitely beneficial exercises that you can do to build strength in your triceps, your biceps, your shoulder blade muscles, stuff like that.
When you talked about the legs, I noticed that the emphasis is really on the big muscles in the upper part of the leg.
Mm-hmm.
The calf muscle contributes a bit, but I imagine not as much as your quadriceps and so on.
So where the calf muscle kind of comes into play is in maintaining neutral ankle position. So it's not so much a power muscle like it is with running, but it is active in terms of maintaining good sort of neutral ankle position. So on the downward sort of propulsive phase of a cycle or a pedal stroke, you want your ankle to stay fairly neutral. Your heel's gonna drop down just a little bit to create more of a bend, kind of an upward bend in your ankle.
Right.
But you don't want your heel to be dropping too low.
So you're not pushing with your feet like a swimmer might, for example, or a runner.
Right, but it's controlling that descent.
So the muscle is you have to use your muscles to keep your feet in the right position as the pedal goes around.
Correct. So it's not that sort of big propulsive, movement like we see, like I said, like we see in runners.
Right.
So the training for those muscles are going to be a little bit different than what runners would do to train their muscles. But they are definitely active. We see it in like EMG studies and stuff like that, where they take a look at muscle activation during different phases of cycling. Those muscles are definitely active. They're just not kind of moving in that same pattern.
They're not pushing you along.
Right.
It's mostly the quadriceps that are the biggest muscles for pushing a cyclist.
And the glute max.
And the glute max.
Yeah. Mm-hmm.
Okay. And one of the things that I've heard about cycling is cyclists engage their lower body quite a bit. They don't engage their upper body as much. You see some people on the Tour de France, for example, with very thin upper arms and so on. For a person who wants to cycle to be physically fit, I would imagine that a little bit of weight training or strength training for the upper body might be beneficial as well as bicycling.
Yeah. So again, I've read a lot of different studies that look at muscle activation in cyclists. When we see increased activation of the upper extremities in cyclists, it's usually in order to engage the core. So we're using our arms to kind of, turn on our oblique muscles and some of these other muscles that help to stabilize us on the bike in an upright posture. And they're actually more active in sort of that cycling kind of out of the saddle, where you're a little bit more, you have a little bit more sort of wiggle room or ability to move laterally, that kind of thing.
When your bike starts to
You're
go from side to
a little bit unsteady.
side.
Yeah, that kind of thing, right. Your arms shouldn't be super active if your core is strong.
Right.
And that's kind of the takeaway message. So yeah, I think that, when you look at these elite cyclists whose arms are really not very strong, it's because they're lean where they need to be, because a lot of them are racing. And their core is so solid that they don't really need to activate their muscles as much in their upper extremities. And then you just see their monster quads and
Right. And they have a very, as you said, they have a very strong core.
Yeah, yeah.
Even though it's thin, it might be extremely strong, and they don't need to use their arm muscles as much.
Right.
But for someone who wants to be more physically fit, and in some ways to appear more physically fit, probably a little bit of upper body weight training might be helpful.
It absolutely doesn't hurt. You need to have strength kind of well distributed throughout your body. Having sufficient strength in your triceps to be able to maintain you in an upright position, especially if your core is weak. It's important to have some strength in your arms as well. Bicep muscles are a good thing to hit as well. And like probably the biggest thing, your shoulder muscles are also very important. But your shoulder blade muscles, these are postural muscles as well as sort of muscles that stabilize your whole upper extremity. So if your shoulder blade muscles are weak or not really doing their job at appropriately stabilizing the upper extremity, then you can develop sort of injuries throughout the chain.
Now, I know it's not your specialty, but when people do weight training for the upper body, what kind of things do they do wrong?
Oh, all kinds of things. So, I think the biggest thing that I see when I go to the gym is I see, these really big, muscly guys, right, that are just throwing up their arms, trying to like use all kinds of momentum to get, weights up there. Technique is more important than anything else. I can take a bodybuilder who has huge muscles, and I can muscle test, some of these smaller muscles that are really kind of deep to these sort of
Big
glamour
muscles.
muscles, right, that kind of stuff, and kind of put them in different positions and strength test them there and see where they deteriorate. So, having proper technique and having the strength to be able to perform an exercise correctly and efficiently is the goal. So, just having kind of maybe taking down the weight a little bit and really focusing on the technique is more important. And that's true for bicep curls, tricep
Deadlifts
dips,
and so on.
all that kind of stuff. Yeah,
So
deadlifts.
when you're bicycling, you said many times the fit is important. It's a big part of your message. And I would imagine that for weight training, it's a similar kind of thing. You should probably get advice from somebody who really knows what they're doing before you start doing that kind of weight training.
Absolutely.
Make sure you're in the right position and so on.
Absolutely.
Just like a bike fit. It's going to be a weight fit in a sense.
There you go. That's right.
One of the things I wanted to ask you about was the position of the feet on the pedals,
Yeah.
and in particular how that might affect knees and other things. I use toe clips, and it tends to keep my feet straight. The clipless toe clips, if that's not an oxymoron. It tends to keep my feet straighter, and my knees feel better than when I didn't use. So you could tell us a little bit about the importance of the position of your feet on the pedals and the angle of your feet.
Sure. So what I'm going to say is your knees are actually kind of an unfortunate joint because they're kind of just along for the ride. They can't really position themselves. They're at the mercy of your feet and your hips. So based on the anatomy of your hip, as well as the anatomy of your foot, whether you're kind of generally just your anatomy is a little bit more toed out from your hip joint position, or whether you have slightly more like flat arches or very high arches. Those are the kinds of things that determine sort of how toed in, how neutral, how toed out your knees, your ankle, your joints that cross those lower extremity or those tendons that cross those lower extremity joints, how happy they're going to be. So generally speaking, the more toed out that you are, it's going to put a little bit more pressure on the inside portion of your knee, the medial compartment of your knee. So I don't know if you've seen somebody with really, really bad knee arthritis where their knee angle is like this, right? Where it's just completely in, right? So those folks tend to have a lot of like either toeing out positioning of their foot, a little bit more of a collapsed arch, things like that. That person who's riding a bike is not going to be as happy as somebody who's in a fixed neutral foot position. So you have to accommodate the bike and the foot position to the rider.
Well, I want to thank you for being here with us today. We've learned a lot, and I think maybe we'll have you on the show again sometime when we can actually see you out on the bike.
Okay.
And you can show us some of this stuff on the road.
All right, yeah, that sounds great.
Well, this is a show that you're probably going to want to record and replay so you can learn some of the exercises Kira showed us today. I've been biking for many years, and I could feel the stretching affecting my muscles. It's always good to learn from a professional.
We'd like to thank Kira Sender, a doctor of physical therapy from Penn Partners Good Shepherd's Rosansky Physical Therapy Center, for joining us today. We'd also like to thank the folks from Good Shepherd's Penn Partners for allowing her to appear on our show. Find out more about them at pennpartners.org.
Join us next time for Bike On CCP TV, the Emmy-nominated educational channel of Community College of Philadelphia. Bike On is CCP TV's program about bicycling in and around the great city of Philadelphia. Goodbye, everybody.